I'm Dr. Metin Çakmakçı from Istanbul, Turkey. I'm a general surgeon. I'm doing cancer surgery mostly, and very complex surgery. Breast surgery is one part and abdominal surgery is another part what I'm doing. I do also a lot of technical surgeries like advanced laparoscopic surgery and robotic surgery also, in addition to the general things.
Welcome in Bucharest, first of all.
Thank you.
Because you are a doctor and you are coming from Istanbul, and I started this series last year, I want to continue to speak with optimism about cancer. We can speak about a friendly cancer?
Sure. Cancer is a broad term. Nearly every tissue and every organ has a cancer. Brain cancer, lung cancer, thyroid cancer, breast cancer, colon cancer, pancreas cancer. There are
Which one is the worst?
Lung cancer, types of lung cancer are worse. Pancreatic cancer is worse. On the other hand, some cancers are very benign, very good, friendly, as you said. You can treat them. And thyroid cancer is probably one of them, with the thyroid gland, very benign. Breast cancer, on the other hand, is also often very benign and treatable and does not pose any death risk if it's diagnosed at an early stage.
What means early stage?
Yeah, correct.
And from what depends this early stage?
What means early? Early means the disease is early. And that depends on the size of the primary tumor, the nodule, the lump is small, this is number one. Number two...
You can feel with the hand?
Yeah, often you can feel with the hand. But again, this is also dependent on the size of the breast, on the structure of the breast. But it is very, very important. Number one is to feel the breast. And early means also the axillary node status. Breast cancer goes first to the axillary, the tumor cells go first to the axillary lymph nodes. If there is no tumor cell in the axillary lymph node, then that means also early. Then the disease goes with the blood to every organ, the liver.
But it hurts? The woman has a feeling? No hurt?
Usually no. My message to every woman is be careful about breast cancer, because breast cancer is the #1 frequent solid organ cancer in women. And the issue with breast cancer is, if we have an early diagnosis, then the disease is nearly always 100% curable, treatable. If we are late in the diagnosis of the disease, then the outcome is not good. Then we are very limited of what we can do.
What kind of treatment you have for this small lamp, for example?
It's very easy.
It's surgery or it's something which destroy, like
it's
on a new equipment?
Surgery is number one, and unless the tumor is very widespread and metastasized, then the #1 step in breast cancer treatment is to remove the tumor. Removing the tumor meant 20 years ago removing the breast totally. Now, if it's a single tumor, it's not multiple tumors, and the tumor is not very big, then we do not remove the breast. We remove only the small part of the breast with the tumor. That's #1 for the treatment. And then we look into the axilla. Again, 10 years ago, we removed the whole axilla lymph nodes. But today we don't do that. We only remove one critical lymph node, which we call the sentinel lymph node. And we diagnose the sentinel lymph node by either radioactive material injected preoperatively into the breast, or a special dye, a blue dye, and then find the axillary lymph node. And during surgery, the pathologist comes into the operating room and looks at under the microscope into this lymph node. If there is no tumor cell in this lymph node, then we leave the axilla. If there is a tumor cells or an accumulation of tumor cells in this one lymph node, then we remove the whole axillary lymph nodes.
So you can check this during the operation?
During the operation, yes.
Wow.
That's normal now. That's the routine thing we do. This is number one, surgery. And then depending on the size of the tumor, on the axillary lymph nodes, on the histologic type of the tumor, then additional treatment like hormone therapy or chemotherapy comes on top of that. And if we leave the breast and remove only part of the breast, then there is a necessity to give the remaining breast tissue radiotherapy. So surgery, radiotherapy, and drug treatment usually come together for a complete treatment of breast cancer.
If we are speaking in time, how many weeks are necessary for have optimistic
treatment?
Yes.
Again, it depends on so many things, but if it's a simple, very early stage breast cancer, then the surgery needs only 1, 2, 3 days in the hospital, that's all. And then radiotherapy into the breast for a month or so, meaning maximum 1.5 months. If there is an extensive chemotherapy, that can go for months later. So it could take a long time for an advanced carcinoma. For an early cancer carcinoma, it could be easy for, as in terms of time, a couple of weeks.
After the operation, you can describe me the post-operation period, because it's very important also. A woman needs a lot of attention after the treatment. Probably it will be a depression, a bad period for her.
It's very difficult for a woman psychologically to have breast cancer, because this is a sexual function. This is an identity of the woman. So you're right. It is not easy for a woman to tolerate breast disease and breast cancer. Even if the woman is 100 years old. Sometimes we think, or people think that it's only important for 30 years, 40 years, 50. It's not. If it's 80, 90, 100 years, it's still a breast. It's very important. But more than the disease is the amputation of the breast. If there is a total mastectomy to remove the breast, that is not good, because that is very difficult for a woman to tolerate. Women think, or the unconscious thinks that there is a loss of the woman side of her body. And then there is depression that's very difficult to tolerate it. And because of that, we tend not to do total mastectomies. We have, in the last years, we always try to do small surgeries to remove only part of the breast with the tumor inside. And often this cannot be seen from outside. So you cannot see from outside whether that woman had breast surgery or not. Be careful. What you can do is know your breast tissue. Try to do a monthly self-examination of the breast and go to a doctor if you think that there is something abnormal. And after 40 years of age, but definitely after 45, you have to go to a doctor who knows breast examination to have a breast exam plus a mammography plus an ultrasonography as a control of your breast lifelong. There is no end to that. And if you do that right, if you have a bad chance of having a breast cancer, but then you will have an early diagnosis with a hopefully a favorable outcome of that disease. Modern breast cancer treatment needs a multidisciplinary team. And in that team, we have surgeons like me, we have radiotherapists, we have oncologists, medical oncologists, we have plastic surgery, we have nuclear medicine, we have radiology, and that group comes together to have a multidisciplinary breast cancer treatment team. This is important because you need the other people. You cannot do everything by yourself. I cannot do it everything by myself as a surgeon. And I need the radiotherapist for the after treatment. I need the medical oncologist. I need the pathologist. I need the radiologist, the nuclear medicine people all together. And we have at our hospital a very good functioning breast cancer team. And sometimes a patient comes with a lump, and the next day we can operate on the patients because we can have the whole diagnostics in one day, everything.